So it's fascinating to think about how the incentives are aligned for the various stakeholders or verticals in the healthcare industry, right? I mean, at the simplest, if you will, you have three, stakeholders. You have the providers, and think of doctors, nurses, but health systems and hospitals, which essentially account for primarily the cost. And then you have the patients in between who actually need healthcare, and then the insurance companies who are paying for healthcare, right? And when I say insurance or payers, I kind of combine the PBMs, combine employers who basically sponsor bulk of the health insurance, at least commercial health insurance in this country, as well as the government, which is Medicare, Medicaid. And then on the provider side, you have pharma who makes the drugs, and so on and so forth. So you have three different distinct entities who are part of this equation. At its fundamental, the providers want to essentially get paid the highest amount that they can get paid for their services, right? It's a basic nature of economics 101. If I am providing you a service, I want to be able to charge you the most amount of money that I can. The patient in the middle will pay a premium for perceived quality and the service that they're getting, right? I mean, as a patient, you would want to pay whatever is needed to get the best quality of healthcare, and specifically in healthcare. And on the other side, the entity, the insurance companies, the payers who are actually footing the bill, they have their incentives completely flipped, because they want to pay the least amount of money for healthcare because they are responsible for the overall book of business, right? So at the surface, these are the misaligned incentives that exist in today's market. And that is in part the reason for our higher cost of healthcare. Layer in the issue of price transparency and nobody really knowing how much healthcare costs, and the variation in healthcare costs. And again, there are nuances. I'm oversimplifying it, but I think this is what I meant by misaligned incentives when it comes to various stakeholders in the equation of healthcare.